Good afternoon, everybody, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have 339,194 cases, 2,419 new cases reported since yesterday, 1,601 people in the hospital, and sadly, 5,039 people who've died. We've passed the grim benchmark of losing more than 5,000 North Carolinians to COVID-19. We hold each of them in our memories. They will not be forgotten. This Thanksgiving week, our state and the country are reporting record high case numbers and hospitalizations. I have a stark warning for North Carolinians today. We are in danger. This is a pivotal moment in our fight against the coronavirus. Our actions now will determine the fate of many. Today, Dr. Mandy Cohen, our Secretary of the North Carolina Department of Health and Human Services, will give an update on our key trends and metrics. She'll also share an update on our county alert map. Unfortunately, the updates are dire. With our metrics worsening and the case counts at record levels, we updated the map earlier than we had planned so North Carolinians can see right now where things stand. This week, you'll see that 10 more counties have been designated as red, indicating critically high levels of community spread. We now have 20 red counties and 42 orange counties. This is deadly serious. We need communities and local governments all over the state, but especially in those red and orange hotspots, to work with us to enforce the strong safety rules we already have in place. With us today is Greensboro Mayor Nancy Vaughn, who will speak about what the city is doing to enforce our statewide executive order with civil penalties when businesses risk public health. But right now, I'd like to ask Dr. Mandy Cohen to present today's data and the updated county map. Dr. Cohen.
Thank you, Governor, and thank you, Mayor Vaughn, for your leadership. Okay, let's get right down to the data. As a reminder, every week we look at a combination of trend metrics: COVID-like syndromic cases, new cases, positive tests as a percentage of total tests, and hospitalizations. In our first graph, we look at people who come to the emergency department with COVID-like symptoms. This is our earliest detection mechanism, and you can see when looking at the yellow line that this trend continues to go up and is significantly above baseline. Next, we look at new cases. This first graph shows you the trajectory of new cases each day since we had our this metric at 5% or below. On our next graph, we look at day over day, also starts in early September. Remember that on November 13th, we changed how these numbers were reported to meet new federal requirements, which caused an abrupt increase in our numbers that you can see. However, even when we account for that change, we've seen the number of people with COVID in the hospital continue to increase, and some of our hospitals are starting to feel the strain. Okay, so here's where we are. Surveillance data has increased. It gets a red X. North Carolina's trajectory of cases is up. It gets a red X. North Carolina's trajectory in percent of tests returning positive has increased slightly. It gets a yellow line. North Carolina's trajectory of hospitalizations is increasing. We still have capacity, but hospitals, again, are feeling the strain. It gets a yellow line. Now that we've taken a look at our statewide metrics, let's see what's happening more locally. As the governor mentioned, given the recent acceleration in our trends, we thought it was critical to give counties an updated data and to help them with their decision making. Therefore, we updated the COVID-19 county alert system with data from November 6th through November 19th. As we shared last week, we created the county alert system to help North Carolinians know how their counties are faring and what they need to do to slow the spread of the virus. The report outlines needed actions for individuals, businesses, and public officials. As a reminder, we use a combination of 3 metrics to categorize counties. First, we use case rates per 100,000 people over 14 days. We use percent of tests that are positive, and lastly, a composite hospital impact score. Using these metrics, we categorize counties into 3 colored tiers to describe their level of viral spread and healthcare capacity impact. Red represents critical, orange, substantial, yellow, significant. And so here is the updated map showing the state, which has counties meeting critical for red and orange. 20 counties are red with critical community spread. That's double the amount we were seeing just last week. 42 counties are orange with substantial community spread, and the remaining are yellow with significant community spread. Remember, we still have a high level of concern for our yellow counties. People in counties that are yellow should take action to ensure they don't become orange or red. Our statewide metrics and county alert map show that we are on very shaky ground. I do not want to see the bottom fall out. I'm particularly concerned about our record number of people in the hospital. The coming weeks will be a true test of our resolve to do what it takes to keep people from getting sick, to save lives, and to make sure you have a hospital care for whether it's a heart attack, a car accident, or COVID-19 when you need it. We know so much more about this pandemic than we did back in March when we had our first case. We need to put that knowledge to use, particularly when the actions are simple and the effects are profound. Masks work. They protect people around you, and they can give you the protections as well. COVID-19 spreads mainly through respiratory droplets that travel through the air when you talk, when you cough, when you sneeze, shout, or sing. That's where the mask comes in. It's a barrier. Studies show masks reduce the spray of respiratory droplets. According to the CDC's chief medical officer, the more people who wear a mask, the more the community is protected, and therefore the more you individually benefit. With our trends where they are, I am asking you to please consider celebrating Thanksgiving differently this year. The safest thing we can do for our loved ones is to follow the CDC guidance and avoid traveling and getting together in person, especially indoors. If you still do get together, please do everything possible to decrease the risk of your spreading COVID-19 to friends and family. Keep it small, keep it outdoors, and wear a mask all the time. Many North Carolinians got tested this weekend ahead of the holidays. Getting a test can let you know if you might have COVID at that moment, but you don't yet have symptoms. If you tested positive, stay home. If you tested negative, that is not a definitive answer or a free pass. A test is only one moment in time. Tests are not perfect, and you could be exposed in the time after you got the test. Even if you have a negative test, you must still wear a mask and stay 6 feet apart. As Chef Chidi Kumar from Garland said last week when she was with us, act as if you could have COVID and could be contagious. Wear a mask, wait 6 feet apart, and wash your hands often. Don't lose hope. We are so close. The Food and Drug Administration is reviewing data on the first vaccine right now to confirm that it's safe and can prevent people from getting this virus. Until then, I know we can do our part to protect each other. Whatever your reason, get behind the mask. Thank you.
Thank you, Dr. Cohen. As you can see, our numbers are too high. Hospitals and healthcare workers are strained, and more counties are moving into the orange and red zones. We've taken strong steps to prevent the spread of this virus, and today we'll do more. Our statewide mask requirement has been in effect since June, and it is still our best weapon in this fight. Today's executive order will further tighten the mandate, making it clear that everyone needs to wear a mask whenever you are with someone you don't live with. That means wearing a mask when you're at home, when you're with friends or family visiting. It means a mask at work, at the gym, at the store, at school. This order also strengthens the role of businesses in ensuring masks are worn by everyone in the store, staff and customers, and that they are abiding by capacity limits so that people can stay distant and can stay safe. Today's order builds on our action to limit gatherings to 10 people indoors, our indoor bar closures, our occupancy restrictions for retail stores, restaurants, and other public businesses, along with our mask mandate. Masks, distance, small gatherings, all of these are critical during the holidays and cold months ahead. The order extends these protections through December the 11th. Wearing a mask over our mouth and nose is the best thing we can do to prevent the spread of this virus. It costs so little, but it does a lot to put countless dollars back into our economy by making it safer to visit stores and other businesses. When we rolled out our county alert map last week, we asked local governments to work with us and step up enforcement. One of those is the city of Greensboro. And I'd like to ask Greensboro Mayor Nancy Vaughn to tell us what they are doing. Mayor Vaughn?
Thank you, Governor. Good afternoon. Thank you for allowing me to talk about the enhanced state of emergency that the City of Greensboro enacted on Friday. In consultation with our healthcare providers and with the busy season upon us, we saw the need to increase enforcement of COVID-19 safety protocols. Our positivity rate is increasing and our hospital beds are decreasing. We were fortunate that Cone Health brought online the recently decommissioned Women's Hospital as a COVID care hospital. It added another 118 beds to their system. In essence, it became our field hospital. Without these additional beds, we would already be over capacity. 2 months ago, we had an average of 36 patients in the Cone Health system. 1 month ago, we had an average of 81 cases. This past weekend, we had 133 patients hospitalized, with 27 of those patients in ICU. Based on Cone's internal projections, we are on track to have 200 to 300 people by February or March. Our numbers are doubling every 27 days. According to Cone Health, 230 people have died in Guilford County since the start of the pandemic. At the rate we are going, they predict we could have 100 more by the end of this year. Greensboro has been enforcing the masking ordinance, but what we found is that most businesses just factored it in as the cost of doing business. We were also challenged by using law enforcement to enforce the order, since their resources were already stretched thin. As of Friday, we gave our city manager the ability to utilize other departments, such as code enforcement, special events, and parking enforcement, to enforce the existing regulations and restrictions. At this time, we did not add any additional restrictions, but we enacted a penalty for exceeding permitted capacity. Businesses can face a civil fine of $100 for each person over the permitted capacity. This is strictly about overcrowding. This part is not tied to people wearing masks. Secondly, all businesses must enforce the face covering requirement on all their employees. Face coverings must cover the nose and mouth. Again, this is taking responsibility for their employees, not the actions of the general public. Any employee who is in contact with the general public must wear a face covering. Employees who are not in regular contact with the general public must wear a face covering if they cannot physically distance themselves from other coworkers. However, based on the announcement today, all employees must wear a face covering inside, whether or not they are interacting with the general public. All businesses must post capacity limits on all entrances and the governor's order to wear a face covering. Proper spacing as per the governor's order must be maintained. For example, spacing of tables in a restaurant or standing 6 feet apart when you're waiting in line. Hand sanitizer must be provided. Now, if a business is found to be in substantial violation of the above requirements, first, they'll be warned. But if we come back a second time and the violations remain, they can be closed for 24 hours. If the city comes back a third time and the violations still remain, they can be closed for 48 hours. If the city comes back a fourth time and the violations remain, they can be closed for 72 hours. This is a health and safety issue. It's important to note that this enhanced state of emergency does not penalize the business for their customers' behavior, only their own. They are in control of enforcement actions. This weekend, teams of city employees visited over 100 businesses to explain the new enhanced state of emergency and what it means to them. We expect that they'll visit another 50 today. These businesses are businesses that we know have a history of compliance issues. Starting tomorrow, the city manager will have a broad cross-section of compliance teams. Just in the last 2 days, we've seen greater compliance. It's simple. In a time of a health emergency, we all need to do our part. Supplies are limited. Frontline healthcare workers are doing a great job, but their capacity is limited. Many business owners have expressed to me their fear of another shutdown. I don't want that either. I want to keep them in business. I want our kids to go back to school, but we must work together to change the trajectory of our numbers. We must reduce the positivity rate. Let's do our part to keep business in business. Thank you.
Thanks, Mayor Vaughn, for your leadership on this matter. I know that other local governments are considering and taking tough action too, and we appreciate their efforts to protect their communities. We know what works in our fight against this pandemic. Wear a mask, wash your hands, wait 6 feet apart from others. These can help us make it safely to the other side of this pandemic. But as I said at the outset, how we get to the other side is up to each of you. We want people to follow the safety guidelines to slow the spread. If they don't, the rules need to be enforced, and we're working with state and local governments to do just that. We don't want to go backward, but we will if it's necessary. The next 7 to 14 days will tell us whether we are stemming the tide or whether we need to ratchet it up even more. We know the other side of this pandemic is not very far off because we have such promising vaccines in the works. Until then, our safety measures will save lives and keep our economy going until we get across the bridge. Last week, the CDC recommended against going to see extended family and friends for Thanksgiving. Please listen to that guidance and adjust your plans as needed. Remember, when it comes to the holidays, smaller and smarter is safer. I know it's been a long 9 months of virtual church, holidays, birthdays, and more. But if we can keep it up just a bit longer, we can ensure that more loved ones make it to next year's Thanksgiving table. We've presented a lot of information today, but our message remains the same. This virus is deadly. It's spreading too fast, and it's up to each one of us to slow it down. Also with us today is the Department of Emergency Management Chief of Staff, Will Ray. David Payne and Monica McGee are our sign language interpreters. And behind the scenes, Jackie Mativier and Erica Kugler are our Spanish language interpreters. We'll now take questions from the media, and we'll take the first one. If you can identify yourself and your organization, we would appreciate that. Thank you.
Our first question is from Laura Lee with Carolina Public Press.
Thank you, Governor. This is Laura Lee with Carolina Public Press. You all have talked extensively about critical staffing needs, and it's now a metric that's included in your composite hospital score. And I'm just wondering, particularly for places like we just saw Guilford change to high in terms of the hospital score, for places that are having these staffing needs, we've talked about the beds there. Are there plans at the state level to deploy staff from other hospitals, either in the state or out of state, should the staffing need become the really critical piece of this puzzle?
Thanks. Good question. We know that hospital bed capacity and ICU bed capacity is something that we want to keep available for the people of North Carolina. We learned a lot in March, April, May, June, when hospitals surged, eliminated elective surgeries, and got ready for the spike that really never came. We've worked really hard to keep our virus spread more level, but we learned a lot, and these hospitals now know when they need to go into their surge mode, and Dr. Cohen has been talking with them on a frequent basis, and I've been talking with them as well. The state is prepared to help with a surge if necessary. There is a facility available that the state has rented in the event that we would need to open an additional space. But I'll let Dr. Cohen talk specifically about what the state can do to help the hospitals that specifically have these strains. So, Dr. Cohen.
Thank you, Governor, and thanks, Laura, for the question. Our people resources, our doctors, our nurses, our respiratory techs, they are our precious commodity as we think about our capacity to be able to surge to additional beds. And it is a real concern. We do have physical space here in the state, but it is the people that we are paying a lot of attention to. And the reality is that with a pandemic spreading as fast as it is, not just here in North Carolina, but around the country, there isn't the same ability for us to pick up the phone and phone a friend in a neighboring state in order to bring in some surges of folks, because they're right now, frankly, they're all in the Midwest, helping some very, very serious situations there where they have absolutely no hospital beds, and they're asking nurses who have COVID right now to keep working. It's dire in the Midwest. We don't want that here, and we also know that there are not going to be the people resources. I think that is why we are so focused on making sure that we can slow the spread of this virus right now. Since the beginning of this pandemic, we've had an ability to recruit volunteers through a state process, and we've been able to deploy those staffing resources largely to our long-term care facilities. We've used that in our long-term care facilities because if they aren't able to be staffed, unfortunately, those folks in nursing homes can get shuttled to hospitals that are already strained. So our focus on the state in terms of staffing capacity has really been in our long-term care and nursing home space to make sure we can focus